Hello, my name is Dr. Tim Kamerman. Welcome to Chiropractic Care Clinic. We're going to be talking about fibromyalgia today and what makes our office different in treating fibromyalgia. I have to go over some ground rules, however. First and foremost, if you come into our office, I ask that you are committed. You need to be 100% on board because fibromyalgia is a very difficult disorder to treat. So I need you 100% on board so we can get this thing underway. The next thing I need to have you understand is you must be prepared to make a lifestyle change. If you're not willing to do that, you're not going to get better. You have got to make lifestyle changes. And so you need to know that up front. The next thing I need for you to understand is that you must take responsibility for your health. It is not the insurance company's responsibility to get you well. It's not the government's responsibility to get you well. It really isn't even your spouse's responsibility or significant other. However, they can make some input, they can support you, but ultimately it is up to you. It really isn't even your doctor's responsibility to get you well. So you must be committed. You must be willing to make some lifestyle changes. Now, having said that, most of you that have fibromyalgia out there have been to multiple doctors. How do I know this? Because when you come in here and I see all the list of doctors you've been everywhere. The problem is all the pieces of the puzzle haven't been put together. And that's what we're going to do here. We're going to leave no stone unturned to get you well. Okay, well, what does that involve? Well, I've taken the last 24 years and compiled all the good techniques that are workable and put them into a single solution to treat fibromyalgia. For example, we are going to have to treat you neurologically. We're going to have to treat you from a structural standpoint to impact your nervous system tissue. We're going to be using different brain-based therapies that are unique to our office. We will incorporate chiropractic if needed, biocranial therapy if needed. And then we're going to look at you from a metabolic standpoint, which means we are going to go through every single test that we need to uncover any weaknesses in the body. Even though fibromyalgia is not an autoimmune disorder by classification, there can be autoimmune factors that aggravate your condition. So we're going to have to know, is there any autoimmune disorders that your body is attacking its own nervous system? We need to know, do you have a thyroid problem? And most thyroid panels that have been done in your case have not been complete. So we're going to go over every component of the thyroid that needs to be checked. We're going to go through adrenal stress index because my findings have been that most fibromyalgia patients have adrenal stress. They're worn out. They have fatigue, they have brain fog, they have depression, in addition to the pain and swelling that's going on. So we're going to go through and look at you from an adrenal standpoint. We're going to cover the basics like you may have already had done before. We're going to do a CBC, we're going to do chemistry profile, we'll look at hormones to see what's involved there. So I think you get the picture. We're going to leave no stone unturned to figure out why your body is not responding. The next thing is, once we pinpoint all the unique weaknesses for your particular case, because even though I've seen many different fibromyalgia cases, there are some common denominators, but there's also uniqueness for each patient. So once we uncover those weaknesses, then we're going to do some very unique treatments in our office, some of which I've already mentioned before. We're also going to use oxygen because oxygen is fuel for your brain. If you do not have sufficient oxygen into the tissue, it slows down the progress of treating fibromyalgia. I mentioned brain-based therapies. We're going to find ways to get your brain, as we call it, firing from left to right uniformly. Okay? So we have some very unique vibration techniques and things of that nature to get your brain waking up and controlling the body properly. So that's a good start as to what is unique and different about our office. Instead of taking one segment of treating fibromyalgia, we're going to take several different segments and bring it all together to make sure you're getting your wellness back. Now, does this mean that you can't include your other healthcare providers? Certainly we want you to continue with treating pain as you have in the past. But let's face it, the patients that have been into my office with fibromyalgia are taking the antidepressants, the painkillers, the anti-inflammatories, and they still are having all the problems. So we know that this has not created a wellness in their body. It really has just controlled certain symptoms. So it's fine for you to pursue that, but we have to understand that controlling pain is only part of the solution. So we're going to take a multifaceted approach to bringing you back to wellness. Now, what do you need to do next? The next thing you need to do is call our office and set up an appointment with me or Dr. Christy Ward. And what we're going to do from there is we're going to sit down with you one-on-one and review your case, and we're going to make sure that we get all the detailed information that is going on in your life, and we're going to help you get well. So I hope to see you in our office very soon. Call if you have questions. We are eager and waiting to help you get well. Have a good day.